Hi guys, my name is Lauren Marshall, and today I'm going to be presenting on issues with the GI system and interventions on how to alleviate and help these symptoms. So first I wanted to include a picture to kind of give y'all a visual interpretation of what organs we're dealing with in this presentation, specifically the esophagus and the stomach. Right here is the esophageal sphincter, and that's going to have a lot to do with our GERD part of the presentation, and then symptoms and that go along with it. And the lower GI system is we're going to be discussing diarrhea and constipation, and that plays a big role. So the first topic of my presentation is GERD, otherwise known as gastroesophageal reflux disease. It's a very common disease. It affects about 40% of Americans, and it's chronic. It results when stomach contents flow back up into the esophagus, and there's many things that can cause that. They diagnose this on symptoms of heartburn and regurgitation. These symptoms can be extremely painful or not painful, ranging from just mild heartburn to like horrible chest pain. Some people relate it to feeling like they have heart issues, but they really are just having GERD symptoms, and it can be painful. So in the picture here, here's a picture of the stomach, and then the blue is kind of the stomach acids and juices, and the sphincter, which we can see in the regular on the left, is closed, whereas on the right, when the sphincter opens, it can cause reflux, and the juices and acid can come up into the esophagus, and that's when you experience the pain and symptoms for heartburn. So there's many things that can cause heartburn. 3 great factors are smoking, obesity, and alcohol. Alcohol specifically makes stomach produce more acid, and it can also make the stomach tissues and esophageal tissues more sensitive to the stomach acid, and that's where you can feel pain. Obesity, when you have the greater fat content around your stomach, it can cause more pressure on the esophagus, and it can also shorten the esophageal sphincter. Smoking and vaping both contain nicotine. That nicotine relaxes the esophageal sphincter, and when it's relaxed, it opens up and it allows the acid to come back up and causes reflux. Luckily, there's a few ways to treat GERD. Choosing a low-fat diet really helps. Avoiding large meals and gastric acid stimulators. These can include tomatoes, alcohol, things that make the stomach produce more gastric acid that can allow for reflux. Standing after you're eating, you're using the benefit of gravity. Standing up kind of lets it flow down, and it prevents the acid from coming up and causing acid reflux. Here's an example of a meal plan that's low fat, that it would be good for someone who's experiencing GERD. For breakfast, oatmeal with fresh banana and yogurt. Yogurt contains probiotics, which can be beneficial for other issues with the GI system as well. Lunch, tuna salad on pita bread with sprouts. And for dinner, sweet potatoes with chicken and asparagus. The next topic is dysphagia. I had previously never heard of this topic until now, but it's the medical term for difficulty swallowing. This can be caused with issues with the neural controls and structures involved with any part of the swallowing process. So like mouth, esophagus. If you have issues with those, then you can have issues swallowing, and it can cause a lot of problems. Causes: acid reflux, the narrowed esophagus. Esophageal tumors can cause issues because then the food can't go down into the stomach and then get caught. GERD, radiation therapy, foreign bodies, dentures can make it hard to chew and swallow. And esophageal stricture, which is a narrowed esophagus. So the food also struggles to go down. In the picture that I've included, where you can see the esophagus right beneath the mouth, on the right, it's closed, so it can cause a lot of difficulty. The risk factors associated with dysphagia when you have it can cause malnutrition, weight loss, dehydration, aspiration, pneumonia, and choking. And this is all because you're having trouble eating, and so you might not be able to get as many nutrients as you would without that issue because you're not eating the right food, and then you might struggle to eat, so you don't want to eat, and you can lose a lot of weight, and it can cause a bunch of issues. They diagnosed this problem with x-rays to see what the esophagus is looking like, and if there's tumors in the esophagus that could be blocking something, and also the size of it, if there's like issues with it being too small. They can also do a swallowing study, an endoscopy, where they take a tube and they stick it all the way down the esophagus, and it has a light on the end, and they can watch a video to see what's going on in there, and then it goes all the way through the sphincter into the stomach, and they can, I've had that done actually, and it's not painful. They put you under, they put me to sleep for that. They can also do esophageal muscle tests to see if it's pushing down properly, and other imaging scans. The treatment of dysphagia, it ranges from the severity of the dysphagia that you're experiencing. So the less severe, kind of more of a neuron issue, you can train your swallowing. You can get that kind of retrain yourself to properly swallow. Whereas if you have issues with the esophagus, maybe being too small or something blocking it, they can do esophageal dilation. And I'll go more into that in the next slide, but dilating the esophagus in a pretty interesting way. Other surgeries, medications, and for extremely severe, if you're malnourished because of it, special liquid diet to ensure that you're getting all your nutrients, and then a feeding tube. So the surgical treatments of dysphagia, as I mentioned in the last slide, esophageal dilation, they actually put a balloon down with a tube into the esophagus where there's a stricture, as you can see here, narrowed, and they can blow up that balloon and it stretches the esophagus out. There's also a laparoscopic Heller myotomy, which they cut the muscle at the lower end of the esophagus to help kind of drain. Esophageal dilation, which I already mentioned, stent placement, and a peroral endoscopic myotomy, which also cuts an incision at the esophageal sphincter. And the stent, just like in your blood, it's placed in there to open up kind of that tube. And now we move on to diarrhea, which many Americans experience. I think pretty much everyone has experienced this. It's kind of the loose, watery stools. There's 3 different types of diarrhea: acute, persistent, and chronic. Acute is maybe 1 to 2 days, persistent a few weeks, and chronic is quite a few weeks. Diarrhea can be caused by many different things: an infection by bacteria. If you have like the stomach bug, which is kind of a very broad term, there could be many things going on, like different types of bacteria and different types of stomach bugs. But for those that have experienced that, know how like painful that could be. Infections by other organisms and preformed toxins, eating foods that upset the digestive system, so foods that someone's sensitive to can cause diarrhea, allergies and intolerances to certain foods, medications, radiation therapy, and malabsorption of food. Symptoms, there's less severe symptoms and then more severe symptoms. So the lesser is bloating and cramping, which can be extremely painful. Strong and urgent need to have a bowel movement, and nausea. The more severe, fever, weight loss, dehydration, severe pain, vomiting, and blood. And these are when you really should go to the hospital, because when you have diarrhea, you're losing a lot of fluids and become severely dehydrated, and they can put you on an IV to replace those fluids. The treatment of diarrhea, antibiotics to get rid of the bad bacteria that could be causing that. The treatment to replace the fluids that are lost in the watery stool, which can be done through an IV, or if you're drinking Gatorade, can replace the electrolytes and help you gain your hydration back. Adjusting certain medications that are causing diarrhea for you, and then diet changes. One that I'm specifically familiar with is the low FODMAP kind of diet lifestyle. It's a 3-step. I'll go into that later, but those foods can really, the low FODMAP foods can really help treat symptoms of diarrhea and other symptoms of like constipation and stuff. So here is kind of information on different stool types. I wanted to include this because when it comes to the GI system, if you look at your stool, you can really find out a lot about what's going on. So you would want your type 4, that would be the most ideal type of stool. But so take a look at your stool, and if you're having kind of abnormally shaped stool, or if it's painful, then you can change your diet, and that might be an easy fix, or maybe something else more serious is going on. So constipation, for example, would be type 1 and type 2 on that information sheet, and that's lumpy or like the sausage shaped type of poop. It's not constipation is what it is. And constipation actually affects less Americans than GERD does, and it's at 12.19% of the general population, whereas GERD's up at 40%. And constipation can be caused by also a variety of things. Medications can cause it, lack of exercise, dehydration, lack of fiber, issues if you already have, such as IBS, ignoring your bowel movements. Traveling can cause constipation as well, and old age. Older people, some of them drink prune juice to help as a laxative, and traveling, when sometimes people travel, can become constipated. Luckily, constipation, there's a wide range of things that you can do to treat your issue. Diet modifications, including more fiber in your diet. On the right here, I've included a picture of different sources of fiber. I love to get fiber from like quinoa or whole grain pasta, leafy greens. Oats are also a great source of fiber, and they can really help treat constipation. It's better to do that rather than going straight towards using laxatives, but laxatives are another treatment of constipation. Eliminating or changing medication that could be causing this, and biofeedback, which can treat chronic constipation caused by anorectal dysfunction, which retrains muscles that control release of bowel movement. So irritable bowel syndrome, it's kind of a blanket term for a lot of things that could be going wrong in the GI system, but it is an intestinal disorder that causes abdominal pain, diarrhea, and constipation. So from what I experience IBS, I know a lot of people that do as well, and I've noticed that the low FODMAP diet is pretty interesting and beneficial in helping alleviate your symptoms, or learn what's going on and then remove them, the things that you might have sensitivity to, and it can make living a lot better. The FODMAP stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols, all of which can be poorly absorbed in the small intestine and prone to absorb water, and they can ferment in the colon, which can cause gas, and it can be extremely painful as well, as gas pain can. Luckily, there are certain things that can alleviate symptoms of these pains associated with IBS, including IBS-friendly teas, heat pads, breathing deeply and relaxing. The FODMAPs, higher FODMAP foods could cause more of these issues as well, gas pain and then other problems, which I'll explain more in the next slide. So the FODMAP diet is a 3-step diet. It starts with your low FODMAP diet, which you go and you research your FODMAPs, like the amount of FODMAPs that are in certain foods, and you just want to eat the low ones until your stomach feels great, until you're not experiencing any of these symptoms. And then FODMAP reintroduction is when you can, very little at a time, reintroduce these higher FODMAP foods into your diet. And if you have an issue with it, then you can write it down and well, this is causing me pain and it's not gonna, so I need to get that out of my diet. And then you can personalize a certain diet that's not gonna cause you issues at all. So if you have some GI issues such as IBS and GERD and dysphagia, that can affect your nutrient absorption. Obviously, dysphagia, you're not consuming the food properly, so that can cause issues with not being able to get enough nutrients, maybe because of your fear of eating or it not reaching the stomach and absorbing properly. In the stomach, such as when you have IBS and stuff like that, it can, you won't be able to readily absorb B12 as well as other people because it requires more stomach acidity, enzymes, and intrinsic factor. And also when you have IBS, nutrient absorption is not able due to digest fructose, bile acid, and other nutrients. So it's good to get tested to figure out, well, I'd recommend getting tested if you're experiencing any of these things, but to know what your stomach is sensitive to, and then maybe nutrients that you're deficient on, and then following other treatment plans, and you can kind of alleviate a lot of these GI issues. So that's the end of my presentation. I hope you all enjoyed it and it was informative. And if some of y'all are experiencing these problems, that maybe I've kind of given y'all different ways to maybe help alleviate these problems or symptoms, or if they're severe, to go and see a doctor and it can really help. Thank you.